Imagine a sickness so rare, so devastating, it feels like a whisper from the darkest corners of the world. A plague that doesn't just claim lives, but twists the very essence of life, turning it into a horrific spectacle. This terrifying affliction is known as Marburg virus disease, MVD, and it represents one of the deadliest viral hemorrhagic fevers known to humankind. The first documented appearance of this terrifying pathogen unfolded in 1967, a chilling mystery that emerged simultaneously in Marburg and Frankfurt, Germany, and Belgrade, Serbia. Scientists and laboratory workers began falling gravely ill with an unknown, severe disease. The common thread among these initial cases was their direct interaction with African green monkeys imported from Uganda, which were being used for polio vaccine research. This accidental laboratory infection marked humanity's first recognized encounter with the Marburg virus, lending the disease its name from the German city where it was first identified. Once inside the human body, the virus launches a devastating assault. Its glycoprotein, GP, binds to host cellular receptors, allowing the virus to enter cells via macropinocytosis. Inside, it replicates, hijacking the host's cellular machinery. The core horror of Marburg lies in its ability to damage blood vessels, leading to a severe condition known as viral hemorrhagic fever. This damage can progress to disseminated intravascular coagulation, DIC. In this severe systemic condition, widespread clotting consumes the body's platelets and clotting factors, paradoxically leading to uncontrolled bleeding from multiple sites. This systemic breakdown explains the horrific symptoms observed in infected individuals. The primary natural host for the Marburg virus is believed to be the Egyptian fruit bat, a species common across Africa. Crucially, these bats carry the virus without exhibiting any obvious signs of illness themselves, making them silent and persistent carriers in their natural habitat. Human infection typically begins with prolonged exposure to environments where these bats reside, such as mines or caves, where bat excreta or saliva might be present. Once the virus makes the jump from animal to human, it can then spread rapidly from person to person. This human-to-human transmission occurs through direct contact with the blood, secretions, organs, or other bodily fluids of infected individuals, either through broken skin or mucous membranes. After an incubation period typically around 8 days, but ranging from 3 to 21 days, the illness strikes abruptly. The first phase, lasting about 5 to 7 days, often mimics common flu-like symptoms: high fever, chills, severe headache, malaise, muscle and joint pain, sore throat, and sometimes a maculopapular rash. This initial ambiguity makes early diagnosis incredibly difficult. The two-phase symptom progression is crucial for conveying the horrific aspect of the disease. It is not just a single symptom, it is a rapid, systemic collapse. The second phase is where the true horror of Marburg unfolds. Patients rapidly deteriorate, developing severe gastrointestinal issues including persistent vomiting, profuse diarrhea, abdominal pain, and even bloody vomit or stool. The hallmark of the disease, its hemorrhagic nature, becomes terrifyingly evident. Patients can experience bleeding from their nose, epistaxis, mouth, rectum, and even from venipuncture sites where needles have been inserted. Most chillingly, bleeding can manifest as subconjunctival hemorrhage, bleeding from the eyes, creating a truly horrific spectacle. Neurological involvement is common, leading to disorientation, confusion, convulsions, and ultimately, coma. The body spirals into shock and multi-organ system failure. Beyond the initial 1967 event, Marburg has re-emerged sporadically, primarily in sub-Saharan Africa. Significant outbreaks include the devastating 1998 to 2000 outbreak in the Democratic Republic of Congo, which saw 154 reported cases and 128 deaths, an 83% fatality rate, largely among young male gold mine workers. The 2004 to 2005 outbreak in Angola was also particularly severe. 2 more recently, the virus has caused first-time outbreaks in Guinea, 2021, Ghana, 2022, Equatorial Guinea, 2023, Tanzania, 2023, and Rwanda, 2024, demonstrating its continued activity and spread across the continent. 3 of these outbreaks underscore the persistent threat and the need for ongoing vigilance. The Marburg virus remains a rare but potent threat, a chilling reminder of pathogens lurking in nature, capable of causing immense suffering.